Have you ever had that dread that your knee problem is just not going to go away and you feel like you're going to have a long-term knee issue? Well, today I'm going to talk to you about 5 things you can do to stop that from happening. My name is Ed. I run a physio practice in Southwest London, specializing in treating knee pain. So let's get started. Let's say you've had a knee injury, or maybe the knee pain has just come out of nowhere and it's just slowly built over time and it's just not getting better. And more and more you have these worries and fears that the knee problem is just going to be there forever. And you kind of think about those people you know that complain about their knee all the time, or they say things like, I've got this dodgy knee so I can't do that. And those kind of things start to go through your head and you start to wonder, is that going to be me? Am I going to need surgery later on in life? Or am I just going to have to stop exercising and stop being able to do what I love to be able to do? Well, all of those things are perfectly normal. And in my knee pain clinic, this is the kind of thing we hear all the time. And there's so much you can do to stop that from happening. And actually, the knee is a really resilient joint, and that's something that we can take advantage of and build people back up to a level where they're back to normal. So let's get started. The first thing that you can do to help prevent a knee problem developing into a long-term problem is to start strengthening. Now, strengthening has lots of benefits. People think that the only benefit to strengthening exercises is muscles getting stronger, but actually there's so many more benefits. Strengthening exercises help to reduce pain. So they have a therapeutic effect and they can help to reduce the pain that you might experience if you have a knee problem. Other benefits include improved sense of well-being, better energy, better recovery and sleep, and the longer term effect will be that you feel more mobile, more active, more able to do the things you want to be able to do. Now, obviously, I'm being quite general and broad here. Strengthening exercises, there's hundreds of different types of strengthening exercises you can do for your knees. The most important ones are going to be quadricep strengthening exercises, so the muscles that live on the top of the thigh, and hamstring exercises, gluteal strengthening exercises, and calf strengthening exercises. In another video, I'll share with you my best 5 exercises for treating knee pain, and I'll make sure I put a link in the video below. The second most important thing when we're thinking about how to prevent a long-term knee problem developing is taking action. Procrastination is often the biggest reason why problems become long-term issues. People kind of hope, they pray, they rest, they do nothing, and over time that can go on and on and on, and before you know it, years have gone by and you haven't actually done anything about the problem that started all those years ago, and you've just kind of hoped that it would get better. So you have to take action. You have to seek help. You have to start a new program. You have to try different things to help yourself make progress. A small example might be walking. You could use walking to try and increase how much your knee can tolerate and reduce the knee pain, and incrementally increase how much you walk every day, every week, every month, to strengthen the knee to help it heal, basically. And that's just one example. But obviously, being a physiotherapist, I'm always going to recommend seeing a health professional like a physiotherapist who specializes in treating knee pain to make it as easy as possible to get better. But taking action is really important. Health often becomes very low down on the priority list for people who are busy, and it's really important to make sure that you don't just let things go and just rely on things like rest to make progress, because actually rest isn't going to be what helps you get better. The third most important thing to do when you're trying to prevent a knee problem becoming a long-term issue is to give it time. If you're going to start a strengthening program, if you're going to start some other type of treatment or intervention, give it 3 months, give it 6 months of effort and time and dedication to see results. It's not something that gets better overnight, unfortunately. And in my experience, treating knee pain for the last 12 years as a physiotherapist, it's very rare that the problem goes away within a few days, a few weeks. Sometimes it does, and that's great, but more often, the work it takes to get people to make progress and stop the problem from coming back takes 6 weeks, takes 12 weeks, and is something that you have to be patient with and have to commit time and effort to. I would always explain it as a bit like having a part-time job. You need to dedicate half an hour every day to your rehabilitation and commit time and space in your diary to do the things you need to be able to do to get better. Because this slapdash every now and then doing some exercises, 1 week doing loads of exercises and then the next 3 doing none, basically result in a whole load of waste of time. It results in very poor results and a lot of frustration. So move health and your knee and recovering up the priority list, and that's where you'll see the benefit. Fourth most important thing is to seek help. Now, I've talked about seeing a physiotherapist, but you could see your GP, your doctor, your physician. You could see a physiotherapist, but in some way, shape or form, seeing a specialist, seeing a health professional is a bit like trying to get somewhere, and instead of just guessing, you're buying a map to get there. So it's going to give you a kind of bit of an idea of where you need to go, what direction you need to take your treatment to help your knee get better. And sometimes what happens is people see healthcare professionals, don't get the result, get disillusioned and just quit. But sometimes it takes a few goes. You have to find the right person, or you have to give it the right amount of time so that you get the result, basically. So the way we would treat this kind of problem, like I said, is strengthening exercise would play a big part. We would use taping techniques, some strapping, some knee supports, potentially at the start of treatment. Then we'd use some more advanced types of rehabilitation exercises later on to really build up the resilience in the knee. And ultimately, then we would get to a stage where we're in what we call the prevent and protect stage. And that would be where we're giving people the tools to stop the problem from coming back. And the fifth one is to keep the faith. I once learned that how much you believe that you'll get better plays a huge part in whether you do get better. And now, I'm not saying you can think yourself better, but you need to find ways of making yourself feel more positive, feel more optimistic, and feel like you're going to make progress and like you're going to get better. Now, sometimes that means seeking help. Sometimes it means other methods, but it's really important to keep the faith and keep the trust in your body, in the fact that you'll get better, to make sure that you get the results. Sometimes if you are very negative, sometimes if you're very pessimistic, and sometimes if you really just don't believe you'll get better, your mind is a very powerful thing, and it's often what is going to happen. So they're the 5 most important things that you can do to stop a knee problem becoming a long-term issue. Leave any questions you have in the comments box and I'd be happy to help. Thanks for watching.